Hello, my name is Raquel Kennedy, and today I'll be doing a newborn assessment, and my newborn assessment is going to be in body, okay? So with my newborn assessment, the first thing I want to do, as soon as the infant comes out of mommy's stomach, I basically want to do my first APGAR score. So my APGAR score should be completed in a minute. And after I've done my APGAR score, I want to do my vitals right away. Okay, so my vitals for newborn would be the temperature. I want to measure my temperature. Temperature should be between 97.7 to about 98.6. My respiration should be between 30 to 60 beats per minute, and then my pulse should be between 110 to 160 per minute. Okay. I after I've done my first after I've done my vital signs, then I probably want to do another UPGAR score. Okay, so my UPGAR score normally is scored between it's a total of 10 points, but anything between 7 to 10 indicates good. It's good, for the infant. Between like 5 to 7, that's moderate. So the infant may need some attention or help, probably with breathing or probably has other things going on. So that's definitely a good indicator. You want to look at those things. The UPGAR score does, it scores cry, irritability, any signs of cyanosis, movement, and if the infant basically has adapted well to outer uterine life. Okay. So after I've done my second APGAR score, and if the newborn is fine, I want to ensure that I clean him off properly, give him a bath, and ensure that I keep him at room temperature the best as possible. Okay. After I've done that, I want to do a comprehensive assessment just to make sure that everything is okay with my newborn. So the best way to approach this is basically to do a head-to-toe assessment, okay? And one of the things that I also want to look for is, they call reflexes. The reflexes are a good indicator of basically any neurological problems that the infant may have. So some of the reflex that I would look for is my Moro reflex, my startle reflex, and startle. If you make a noise or something and the infant like jumps, you know that the startle reflex is good. Panic reflex, if the infant moves the head from one side to the other. The palmar or the grasp reflex, basically if you put your hands and the infant automatically just grasp their hands, okay? Also the Babinski reflex. As I said, I want to do my head-to assessment. So I'll start from my head and then I'll go all the way down. I also want to get measurements of my infant, okay? So I would first want to measure the head circumference, the chest circumference, and normally the head and the chest, they're about equal. Sometimes they can be a little off, as well as I want to measure the length of my infant, okay? So I'm going to first look at the head of my infant, make sure that everything is symmetrical, and hair is evenly distributed. Some infant may, be born without hair. I mean, it just depends. Every infant is different. I then want to make sure that, the head is symmetrical. There's no bulging. Sometimes bulging or like, head shape can be a little off because of the whole delivery process. But if there's any cephalocaudal hematoma, I want to make a notation of that. Also, I want to feel my fontanelle just to make sure that it's soft and it's not bulging, or there's no indication of hydrocephaly or microcephaly. Okay. Um, so after I've palpated, I'm going to do my fontanelle. There's one fontanelle here in the anterior and then one in the posterior, okay? The one anterior, normally it closes like 9 to 18 months, and then the one posterior will close around 3 to 6 months, normally around 3 months it closes up, okay? So I'm going to look at my eyes, make sure that everything is symmetrical. I want to assess for eye, they're both equal, responsive to light. They both dilate and constrict at the same time. And then, sometimes it's hard for the infant to open their eyes so that, probably won't be able to assess. But if you are, then that's what you look for, okay? Then I want to look at my nose, just make sure it's patent. Also just assessing my infant just to make sure that he's breathing okay on his own and also adapting very well to life. Then I will want to look at mouth, look at mucous membrane, make sure that there's no sign of any cyanosis. Put my hands in mouth and would assess for the soft reflex. I also want to look at the uvula, just make sure that that's patent, okay? Then I go to the neck, just make sure that it's not short, but it's normal, okay? Because sometimes when they have short neck, that's an indication of a neurological deficit. Okay, then I'll go to my hands and the shoulder area, and I want to just assess just to make sure that there's no crepitus. I want to assess the chest area just to make sure that there's symmetry there. There's no signs of any retractions or nasal flaring, okay? Then I want to make sure that I look at my nipple just to make sure that they're equal as well. Then I'll go to at this time, if the infant is quiet and probably sleeping, I can auscultate my lung sound as well as the heart, just to make sure that everything is normal. Otherwise, if the infant is crying very irritable at this time, then we can do that later. Okay, then I'm going to go to my belt, my abdomen, assess for symmetry as well. Make sure the umbilical cord is like center or midline, and there's no pulsation going on, and there is no evisceration or anything like that, no organs or whatever falling out. Of course, before you would probably notice that, okay? As well, just listen to your bowel sounds. Check umbilical line. Then you basically you could at this point you could turn the infant over on the back, and you could assess the spinal curvature just to make sure that it's midline and it's patent, and it's there's no type of deviation. Okay. Then you want to look on the perineal area just to make sure that everything is normal. There's no hypospadias or epispadias, or everything is patent and looks normal. There can be abnormalities where that's concerned. Then you want to look at the infant buttocks, and see if there's any abnormalities. You could check the rectum, anus, just to make sure that everything is patent back there as well, okay? And then check the legs for any crepitus, okay? Then you basically go down to the legs, check for any abnormalities. You're going to assess basically both of them bilaterally, so compare one to the other, just make sure that they're symmetrical. Okay, and then you want to look at the toes and just make sure everything is okay and normal as well. So they're both the same, symmetrical. At this time, you also want to assess the extremities, so that will be the hands and feet. You can assess for capillary refill, just to make sure that's good. There's no signs of cyanosis. You can assess for the pulses, which is the dorsalis pedis. And then for the fingers, you could assess the brachial pulses, okay? Also, at this time, I think we are finished with the assessment with the infant. Also, however, you want to, you always want to collect baseline data. Of course, you want to also weigh your infant to get baseline weight. Normally, the infant or the newborn, when they're just born, they normally lose a couple pounds, but they will gain it, or not a couple pounds, but about a pound, or 1/10 of what their weight is, and then they'll gain it back within couple days to a week. And also, all infants are different, so one infant may do this, while others, may do that. So it's better to use baseline data for that infant and compare how they're adapting and growing, okay? As well as you want to use the growth chart just to see where they are compared to where they are on the growth chart, what percentile level they fall into. And that completes my newborn assessment. Thanks. Bye.